Okay, Dr. Burns, you're a cognitive therapist. Actually, I'm not. I'm a team therapist. It's a big difference, but I certainly helped put cognitive therapy on the map with my first book, Feeling Good. And they say, oh, well, you're a cognitive therapist, and all cognitive therapy people do is deal with thoughts, and thoughts can't deal with physical sensations. And anxiety has physical sensations, and anger is filled with rage and physical sensations, and people sometimes have aches and pains that the doctors can't solve. So aren't you missing the boat, Dr. Burns? Well, no, I'm not, actually. Stay tuned and find out why. We have a little short commercial for you about the Feeling Great app. Tell me, why should anyone watching right now care about our Feeling Great app?
This app was designed very specifically in combination with you, David, and me, a trained therapist, to provide you with not just understanding, not just support, but a very structured and specific path to feeling better today. And impressively, after just one and a half hour session, most people on average have seen a 60 to 70% improvement in their negative feelings.
Which is amazing, because if you look at all the world's outcome studies with psychotherapy or antidepressant drugs, there's nothing that comes close to those numbers even after 6 months, 12 months, 18 months of treatment. Now, the app is not treatment, it's a self-help device. It's incredibly powerful. It simulates exactly what I would do or what Adam would do in working with you in a live session. So check it out for free. You've got nothing to lose, and you have a life of greater joy and greater self-esteem as a reward. We love you all, and thank you for listening to our little commercial. Recently, we've got some really awesome questions from our webinar fans. People often ask me about somatic sensations, like if you're anxious, you have a racing heart and your skin is tingling, and also some people, when they get upset, they get physical pain, and a lot of physical pain is really the result of emotional problems that the person is not attending to. And people think that we have to have some special somatic type techniques in order to deal with somatic type symptoms. But that has not been my experience. And when people radically change their thoughts and stop believing the thoughts that are upsetting them, like I'm worthless, or I'm about to have a panic attack, I'm about to die, I can't breathe deeply enough, or whatever it is, the physical sensations follow the thoughts and feelings, just like the baby ducks follow the mother duck. And when the mother duck turns right, the baby ducks follow her, and they also turn right. And I can give you some examples, because in this case, a picture is perhaps worth a thousand words. Recently, I've posted a video of a woman having an actual panic attack in my office, and she'd been having panic attacks, Terry, for 10 years, and no one had been able to help her. And during each panic attack, she'll kind of get upset about something. She was having 5 of these a week and going to emergency rooms, always thinking during her panic attacks, I'm about to die. I can't breathe deeply enough, and my chest hurts. Her thought during a panic attack is, I'm about to die. And that thought generates tremendous physical sensations and panic and anxiety. And if you have the thought right now, I'm about to die, I'm about to have a heart attack, I'm about to have a stroke, and you believed it, you would get a lot of physical sensations too. And the technique that was helpful for her, and you can see it, you can watch it if you like, because it's on our Feeling Great channel on YouTube. But I induced a panic attack at the beginning of the session with her permission, and this terrified the bejesus out of her. And the intervention that I used was called the experimental technique, getting Terry to test her belief with an experiment. And the experiment was, I persuaded her to stand up, and she told me she'd pass out if she stood up, but I knew she couldn't pass out because her heart was racing and her blood pressure was elevated. And fainting is caused when your heart rate slows down suddenly and your blood pressure falls. But I asked her to stand up and then run in place. And she kept protesting that she's about to die, that she can't do this, that she's in tremendous pain, and she has all these physical sensations. But I pushed her, which was out of kindness, because I knew if I backed off, it would actually make her panic attacks worse. And After about 2 or 3 minutes, she said of running in place, she said, I can't go on. I'm too weak. I'm about to have a heart attack. I'm about to die. I said, well, try some jumping jacks. And she said, I can't possibly do any jumping jacks. I said, I know, but do some jumping jacks anyway. And I've got all this on video. You can watch it, and seeing is believing. And so she starts doing some jumping jacks. And slowly, and I said, speed up, and then after about maybe 20 or 30 seconds of doing the jumping jack, she said, I wonder if I could do this if I was having a heart attack. And that was what I'd hoped she would see. And I said, is this what you see in emergency rooms of hospitals, patients standing next to their gurneys doing jumping jacks? She started laughing and doubled over laughing. When she stood back up, I said, continue with your jumping jacks. I'm sure you'll pass out at any moment. And then she doubled over with laughter again and blurted out, I'm feeling a whole lot better. And that ended 10 years of failed therapy with massive doses of practically every known drug from psychiatrists and psychologists and emergency room visits, and her symptoms it disappeared. So the moment she stopped believing that thought, I'm about to die, the very moment she stopped believing it, it all disappears. And that's been my experience. And so this is going to sound harsh. And I asked the person who's running the camera, she's got great judgment, should I be, Mr. Nice or controversial or what? And she said, I'm allowed to have a very slight edge. And so I think the people who are pushing all this somatic stuff, to me, it's bullshit. And I mean, it's all they know how to do. They're promoting their wares. They want patients. They have to make money. They have to stay in business. But I have never seen that as having any particular help. In fact, when I was a medical student at Stanford, I worked with Alan Barber in the thick chart patient clinic. These were patients came from all over the Western United States to Stanford because they had intense physical symptoms that no one had been able to diagnose or treat, dizziness, excruciating belly pain, headaches, fatigue, all kinds of symptoms. And what we saw in that clinic was that half of the time these patients had a problem in their life that they weren't dealing with, like a marital problem, or the wife had died, and at the funeral, the husband who loved her thought, I'm not supposed to cry, and he started getting dizzy. And for 6 years, he went to doctors, and they spent hundreds of thousands of dollars on medical tests. Why is he so dizzy? Thinking he needs some kind of medical intervention. But when I saw him with Alan Barber, we found out that when you first got dizzy, what was going on? And he said, oh, I was at my wife's funeral, doc. And Alan Barber, the head of the clinic, said, you must have grieved tremendously. It sounds like you loved her. And he says, no, I've never cried. I don't know if a man is supposed to cry. And there were tears going down his cheeks. And we said, it's time for you to grieve. It's a healthy thing. It's the right thing to do. And he began sobbing, and just sobbed for several minutes, and tears were going down his cheeks. And he had his head in his hands. He was just sobbing and sobbing. And then he finally looked up and said, Doctor, my dizziness has finally disappeared. I think I'm cured. And he was. And we saw patient after patient like that. When they addressed the problem in their life, these physical symptoms disappeared. And these were patients with physical symptoms severe enough not to go to a psychologist. They were going to a Stanford Medical School, medical center at the top outpatient medical clinic to see the head of outpatient medicine at Stanford, because other doctors hadn't been able to treat their symptoms because they got trapped in the medical model, thinking there was some medical thing, whereas really a human thing. And so that's where my bias is. I used to do 2-day workshops and 4-day workshops around the U.S. and Canada. And it was a lot of fun in my younger days, and I met a lot of therapists, and I loved teaching. I still do love teaching. But At the end of a one-day workshop, this couple came up and they said, David, we love all your externalization of voices and all these powerful techniques you've developed to deal with depression and anxiety. But how about the somatic side of it? And I said, well, what do you mean? They said, well, when people have like phobias, it's always due to some suppressed trauma. And it's hidden in their body somewhere. The body knows the score. And we're specialists in that, and we can find where phobias are hidden in a person's body, and then we do somatic therapy, and then when we work out that knot, in their back or whatever, then their phobia disappears. And I said, oh, well, that's interesting. I must admit I'm a little bit skeptical. And they said, well, if you like, we brought a mattress to the workshop, and we have it here. And if you like, you can just lie down on it and we'll do our thing on you. They said, do you have any problems? I said, yes, my fear of heights has returned. I overcame it when I was young, and then I forgot to keep exposing myself to heights, and it came creeping back. So is that something you can handle? They said, oh, yes, we'll locate your fear of heights as some trauma that you've had, and it's embedded somewhere in your body, and we'll locate it and work it out. So I lay down there, and it was kind of like a massage thing, and they were trying to locate where my fear of heights was. And they finally said, oh, here, we found it here. Or I guess they found a knot in my back, or, some tight muscle or something like that. And so they massaged it and loosened it up, and they said, okay, you're good to go. And it only took about 20 minutes or so to be cured. And I said, well, that's really great. And is my fear of heights gone now? And they said, absolutely, yes. And so that they've scored that as a home run in their book. But I knew that we were going to have dinner together that night because we were invited to this dinner. And so I said, well, do you want me to check it out at the hotel? And then I can tell you at dinner. I said, oh, yeah, that'd be great. So I went back to my hotel, and I went up to the 8th floor, which was where my room was. And it was one of these places where, there was a kind of an inner area and you could look over. And so I went over to the edge and looked over, and I said, oh my God, I think I'm going to faint or something. And I was just absolutely terrified. And so this is some good information for them. They'll realize that their intervention had not been effective. And if they're scientists or humble or honest, they'll want to process this information. And so at dinner, I told them, I really enjoyed the attention you gave me, and I learned all about the somatic therapy, but it actually, to be honest with you, had zero effect on my fear of heights. And it was as if I went in one ear and out the other. And they just went on talking, telling the people what wonderful therapy they did with the trauma that's stored up somewhere in your body. And I was thinking, my God, are these people, con artists? What's the deal here? But anyway, that's my point of view and my experience. And I've had maybe 50,000 hours working with people from all around the world with the most severe depression and anxiety you can imagine. And just about 100% of them had somatic sensations and issues. Depression's a total body experience. But the moment your depression disappears, your body changes. I'll give you one more example. Well, this is way too long an answer, but I love this question. When I got my book Feeling Good published, it was hell on wheels. I couldn't get any publisher to be interested in it, and I had an agent, and he couldn't get anyone even to reject it. And it was so discouraging. And finally, I decided to tell the agent, if you'll stop representing me, I said, I'll still give you your 10% if we ever sell it. But I want you to tell all the publishers that you've given a copy of my book that they have 10 days to reject or accept my book. And he said, that's a terrible idea, and it'll never work. And I said, I don't care. That's what I want you to do. So he did it. And so he told them all. And then at the end of the 10th day, not a single someone had contacted me, and I just picked up the phone by chance and got one of the publishers on the phone in New York. And she said, "Oh, Dr. Burns, yes, so good to hear from you. I apologize. We haven't gotten your rejection letter back to you yet. It's still in the typewriter, and it's been dictated and half typed out. But the typist had to go home for the weekend, so we'll be sending it to you on Monday." And then I got to using my 5 secrets of effective communication and talked to her and told her how great she was, which I didn't believe, but it seemed to be the thing to do. And she got all excited and made me an offer for the book. And she wanted me to come up to New York on Monday and maybe meet with a top ghostwriter or have somebody co-write it with me. And that was exciting. And then Monday I called the publisher that I'd been told would have been the best, which is called William Morrow. It's now HarperCollins. And Maria Guarnaschelli there. And I said, "Maria, I just want to let you know that one of your competitors has made a strong offer on the book, and so you hadn't gotten back to me, so I'm going to withdraw it." And I knew that would spark her interest, and she got all excited, and she said, "We'll make you an offer you can't refuse right now if you agree to stop negotiating," which I did, and they made me what seemed like a huge advance. And I had to go up to New York and meet her and get my check for half of the advance. And she just said, "Oh, darling, this is going to be a #1 bestseller. And it's so wonderful. The only problem with the draft you sent is it's very boring and no one will like it. And so you have to rewrite it." And she gave me a couple of sentences. I said, "Rewrite it like this and just take it home to, Philadelphia and come up with a bestseller for us." And I got home on the train. I started getting depressed, and it was a body experience. And my energies and my enthusiasm started to disappear. And I went home, and I had blocked out a week just to start revising the book. And I sat at my desk all day for, day after day, and I couldn't get a single sentence out. And I couldn't understand what was wrong. I had no energy. My body felt like lead. It was heavy. I had been running daily. I'd gotten up to some long distances, and I went out and tried to run, and I had no energy. I couldn't run for even more than a block. And then I'd have to walk home and rest. And I said, "Well, David, why don't you do what you tell your patients to do? Write down your thoughts. What are you telling yourself?" And I thought, "Oh, that's a good idea. I should have done that a long time ago." So I got out a piece of paper and I wrote down my negative thoughts. And #1 is, Maria's going to be disappointed in me because I don't know how to write a best-selling book. I'm a psychiatrist. I'm not a pop psychology author or anything, close to it. And I said, that's the thing that's been bugging me. Now, how could I talk back to that? And I decided to talk back to it like this. I said, "Well, David, why don't you tell yourself that you don't have to write a bestseller? It's not your job to sell this book. That's Maria's job. That's the publisher's job. That's the advertising people there at the company. It's your job just to talk to the readers the way you talk to your patients and explain things to them really in simple, clear English." And I thought, "Oh, yeah, that's cool. That would work. That people would like that. And that's something I can do." And instantly, because my thought changed, see, I no longer thought I'm a failure. I'm going to let Maria down. I had a new thought. Oh, there's a way I can solve this problem. And I got all excited. And I got so excited. I had so much energy all of a sudden that I went out and I ran something like 8 miles through a very hilly terrain at very high speed. I felt like a deer in the forest running. And so that's another personal example where the moment I changed my thought, I stopped believing what I was telling myself, my feelings changed. And the moment my depression disappeared, my whole body chemistry changed at the same time. So there's a long answer to what I thought was a fantastic question that was worthy of a long answer. And if you only got it part way through, you got some of my thinking. And if you listened all the way through, you got all of my thinking.